So thank you so much, Professor Faiz, for this, for taking us through this really amazing journey at the interface of science and policy, but I would add more, science policy community interface, because I think your work and your career has really navigated the three fields, the field of science, medicine, policy and engagement, and community engagement, which is absolutely crucial when it comes to better understanding, preventing, and controlling these public health issues at the interface of people, animals, and the environment. It is also very interesting, we think about it, both malaria and snake bite are both about bites, right? Mosquito bites and snake bites, right? Very different diseases, but still public health issues at the interface of people, animals, and the environment, both climate-sensitive diseases, and both really very relevant for the One Health conversation that is about to start. So I'd like to move now to the panel discussion. And I'll be accompanied by a group of experts and global health leaders representing different sectors. We'll have the World Health Organization, Gavi Alliance, the Vaccine Alliance, and academia as well. So I'd like to start and invite Dr. Park. Dr. Park works with the World Health Organization in Western Pacific region. He is the director of the management program of strategic planning, budget, and health system thinking in the Western Pacific. Dr. Park, please join us on stage. Thank you. Yes. Next, let me invite Dr. Nishtar from Gavi. Dr. Nishtar is the CEO from Gavi, the Vaccine Alliance. She is a physician by training and a global health leader with more than 30 years of global health leadership. And also, she served as the special advisor, special assistant for the Prime Minister of Pakistan. Please join me on stage. Thank you so much. And finally, representing academia, at Yonsei University, we have Professor Kwang, who is also the president of the Korean Society for the Unification of Health and Medicine, former director of Korean NIH, and you were also seconded at the World Health Organization in Geneva during Dr. Lee's tenure. Thank you so much for joining us. Okay, so I'm very impressed. This is an amazing group of leaders and experts, and I'm very pleased to be part of this conversation. So let me start with Dr. Nishkar, if I may. I'd like to hear from you on how, in the context of a very rapidly, we're trying to frame this conversation a little bit around the climate crisis and One Health. So in this rapidly changing environment and the rapidly changing landscape of infectious diseases, right? How is Gavi, and more broadly, how do we improve timely access and equitable access to vaccines, particularly in areas of the world where climate change is hitting highly vulnerable populations? Thank you.
Well, thank you very much for this conversation on One Health. I think it's becoming increasingly evident that there's an inextricable relationship between animal health, human health, and environmental health. And in our line of work, we see it playing out very, very often now. So diseases are appearing in areas where they were not recognizable at one point in time. And of course, vaccines have a very strong linkage with the climate health nexus, because there are many diseases that are climate sensitive which can be prevented by vaccines. Yellow fever is a case in point. Malaria is another case in point. And increasingly we are seeing, as part of our line of work, that when climate catastrophes happen and when you get droughts and floods and torrential rains, there are outbreaks of diseases that can be preventive and tackled with vaccines as well. Over the last 2 years, we've seen an enormous increase in cholera, for instance. And of course, we then mobilize our cholera stockpiles. Yellow fever is another example. And the malaria vaccine is particularly relevant in this context. And there's a huge appetite from countries to introduce and scale up the malaria vaccine. This is the newest vaccine in our portfolio. It's taken us 30 years to get to where we are. And we have experienced the fastest rollout of any vaccine in history. 25 countries have adopted the malaria vaccine over the last 18 months or so, and there's a huge demand. So your question about equitable access is very important. And of course, ultimately, it comes down to the available funding based on the existing models. Now, I have to say that I don't want to just complain and say that funding is dwindling and funding is the only bottleneck, because there is also a silver lining. As ODA is declining, countries are stepping up and they're saying, we want to plow in domestic resources, we want to increase our resource mobilization capacity, and we are seeing that in particular in Africa. But our malaria vaccine program has taken a bad hit as a result of the program recalibration we've done, given the resource realities. As you know, Gavi is in a 5-year strategic, a 5-year strategic period has just kicked off. And our ask for this strategic period was $11.9 billion. We were able to mobilize 10. So of course, we've had to make some difficult trade-offs, and the malaria program was one of them. But while I have the floor, I also want to say that this is just the right moment to be talking about the One Health approach. And why do I say this? Because Geneva is abuzz with conversation on the global health architecture reform. They've been ongoing for the whole week. The WHO has a new process, and now that member states are going to be aligning upon. And reform of the global health architecture, and especially when it comes to the landscape in Geneva and in Western capitals, is a lot about rationalization and cutting down and reducing duplication, fragmentation, and competitive behaviors, and we completely agree and get that. But we must not forget that this is also an opportunity to build into the global health architecture the competencies that do not exist today. Dr. Cha talked about AI and the profound potential of AI. Today, there is no entity, no capability responsible for to counter AI-enabled bioterrorism threats. And the subject that we are discussing and which you steward at the University of One Health is one of them. This is the right moment to say we need a new global health architecture which is grounded in One Health, where we are going to create the systemic incentives to break the silos between animal and human health. And it's entirely possible to do that. And I think it's not just the global health architecture, it's also about how country institutions are structured. We think governments are one entity, they're not one entity, it's an archipelago, and there are competing institutions. So now that the declining ODA has brought in a context where we need to rethink institutional structures, this is just the right moment to put One Health on the table.
Thank you very much. I think you've opened so many exciting boxes there, and I have so many follow-up questions right away. But I'd like to hear from Dr. Park, also building on what we just heard. How do you see, and based on your work in the Western Pacific, how do you see, first of all, can you maybe explain to us how do we build a climate-resilient health system, and what it takes to actually do this at the primary healthcare level and the community system level, especially considering the fact that Western Pacific, as we heard at the very beginning, is one of the areas of the world where climate change is hitting particularly strong. So can you take us through this idea of a climate-sensitive and climate resilience of the health system? Thank you.
Thank you. As mentioned by Dr. Saya Piukara, Western Pacific region is the home to 2.2 billion people. The impact of the climate change are no longer a future risk. They are already affecting lives and health system in the region every day. Climate change comes with rising temperature, extreme weather events, sea level rise, and changing rainfall patterns, we are observing increasing the spread of the vector-borne diseases such as dengue, disrupting food systems, water security, livelihood, and mental well-being. Last year, we witnessed a sharp rise in dengue cases across the region, with several countries declaring national emergencies. Climate-related shocks are also placing increasing strain on already stretched health services, particularly in rural and remote communities. This is why climate change must be integrated into primary healthcare system. WHO advocate for primary health system resilience to climate change and climate crisis. Resilient primary healthcare systems are essential because they are the first point of the contact for communities before, during, and then after climate-related emergencies. They must be able to continue delivering essential services during disasters, detect emerging health threats early, and support vulnerable populations whose health risks are intensified by climate change. So we must invest on local health workforces and community health workers. We also must invest on disease surveillance, risk communication, climate-informed early warning systems. Not so good news is we cannot strengthen climate-resilient health system without adequate financing. Although climate finance is increasing globally, health still receives only a small portion, only a small share of the available funding. And many low-income and the middle-income countries, many climate-vulnerable countries continue to face major barriers in accessing climate and health financing. To help address gaps, WHO has launching practical initiative we call ACE-FIT, the Access to Climate Finance and Investment Tool for Health. Last year, ACE-FIT workshop engaged countries including Cambodia, Kiribati, and the Philippines. And this year, the initiative is expanding to additional Pacific Island countries. These efforts are helping countries build the technical capacities needed to develop climate-resilient primary healthcare systems. WHO in the Western Pacific region is also deepening partnership with financing and development partners, including Green Climate Fund, COICA, and then Asia Infrastructure Investment Bank to support sustainable investment pathways to climate-resilient health system, climate-resilient primary healthcare systems. Ultimately, strengthening climate resilience in primary healthcare is not only about protecting health systems from climate shocks. It is about protecting people, especially the most vulnerable communities who have contributed least to climate change yet face the greatest risk. This requires a strong international cooperation. By advancing this partnership and investment, we honor Dr. Lee's legacy and protect our shared future.
Thank you so much. That's indeed, both of you pointed to the funding aspect and the finances. Maybe we have time at the end. I'd like to come back to you and also explore this idea of the partnerships. Not only what are the funding mechanisms that are required, but also what are the critical partnerships that go along with that. Thank you so much. Let me now go back to this very changing landscape. As we said, we see the number of emerging infectious diseases increasing very rapidly over the last decades, right? We also see these days Ebola hitting Central Africa, Andes antivirus, both zoonotic infectious diseases. How, as an expert, Professor Kwong, as an expert in One Health and infectious diseases, what are the practical tools? How do you see One Health as a tool to facilitate international, national coordination and collaboration between sectors, institutions, disciplines?
Thank you. Before my comment for your questions, I just remember last year in Korea, Gyeongju, APEC summit, only the Chinese leader, his name is Xi Jinping, proposed a new international organization governing AI, World AI Organization something. So, however, no other world leaders just concerned about that, do not. So I think that anyway, this area, there are so many new governance for technology even in the public flow, so we must remember. Your question, I'm surprised you remember the Hanta. Hanta is actually the name of a Korean famous river, and another Dr. Lee, Hoang Lee, found the pathogen, and anyway, I think that
Go ahead.
yes. I think that there are so many several factors contributed to the emerging infectious diseases in real world. First of all, climate change, and secondly, rapid advancement of transportation and global connectivity, and the expansion of human mobility and interaction, including urbanization and the migration. So I think that Dr. Lee also emphasized the partnership, even the responding to the threat of emerging infectious diseases. So One Health is just the necessity. So we must focus on based upon One Health approach. One Health recognized the interconnectedness of human health, animal health, and the environment. It calls for integrated cross-sectoral collaboration in addressing health challenges. And One Health is not merely a conceptual framework, it must be operationalized in real-world settings. So I think that there are some three elements in One Health approach. First of all, integrated surveillance system is the basic starting point, and then secondly, collaborative response mechanisms, surely, and finally, I think that for ideal approach, joint field investigations and real-time data sharing is also very important. However, I want to emphasize, rather than any platform or technology, Dr. Lee always talk about people. So I think that ultimately systems and technologies are only as effective as the people who operate them, who operate One Health. So people is very important, and partnership is also important. So we need more collaboration and coordination between all the personal advances and the international organizations, governments, and all there are so many elements. However, we must think about that always the people. So human resources is the most important thing to educate them with the concept of the partnerships is very important. Dr. Lee always focused and emphasized the concept of partnership based upon recognize the role of each individuals. Yeah, that's my point.
Thank you so much. One Health is by definition, this is what I always share with my students, One Health by definition is a transdisciplinary approach, and transdisciplinary means we engage with communities, right? So I'd like to move to Professor Faiz. A lot of your work, and you presented in your slides these beautiful photos, your work in the field, right, in close contact with the community. So I'd like to hear from you, after all these many years working closely in contact with the communities on malaria, on snakebite endeming, what are the challenges and, on the other hand, the opportunities or the interests of engaging actively as a scientist, as a physician, with communities that are suffering these problems like malaria or snakebite endeming? So how do we better engage with communities using One Health, in other words?
Thank you very much. I think in continuation of the comments by our learned panelists, I particularly like to refer to the climate-sensitive conditions. What is happening now? Currently, the countries being affected by climate effects, they do not have enough strong health system. At the same time, they consider this as a part of disaster. So through the lens of disaster, through the lens of disaster means what are the casualty. So instead of considering in the terms of casualty, I think this should be a frontline priority. Health should be a frontline priority. So currently it is the trickling from the center down to the community is a long process. So also the funding process. So I think engaging the community upfront will be very essential. Engaging community beforehand during these disasters, during this impact. I think the experience currently with the various conditions, the community is quite well conversant but the process is so slow, so bureaucratic, it should be streamlined faster enough. There are good examples. For example, there is a global fund for malaria, TB, HIV. I know that there are fund restrictions, but still, this is a good example. So funds should not be discrete from different small components. Instead of that, they should be category-wise. And then at country level, this is a really multi-health, multi-ministry related condition. So this is really not only one health, this is also one approach of whole of the government approach. So through the whole of the government approach, one health approach is one of them. So as it requires more than one ministry, but at the end, when the community involvement related to health comes, this funding has been found to be very much fragmented, very much discrete. So community engagement with the existing knowledge, it is their problem. They can provide support, they are resilient. So I think there is no option but to engage in the community based on the existing lessons from the vaccination, from the non-communicable diseases, from the maternal health. So I think this is a common knowledge pool that can be strengthened further to engage the community for these conditions. Thank you very
Excellent.
much.
Thank you. Thank you so much. Yes. So, Dr. Nishka, I know you have to leave us, and we are wrapping up right now. Can I ask you a final word before you leave us and before we close the session? What's your message to the audience? What's the message to the global health community sitting here today to close this session? Thank you so much.
I think we need to look at the context here, because the situation in DRC and Uganda, we're looking at an emergency, we're looking at an outbreak, and it's a very sobering moment. Because back in 2018, when the vaccine was available and at the outset there were 30 deaths and 60 reported cases, it took us 2 years to bring it under control with the vaccine available. Today, the Ebola outbreak is a very different story. We're talking about northward of 600 cases, 160 deaths. For every 2 people tested, 1 tests positive. There is no vaccine available. And I think this should be a wake-up call to us as far as the One Health is concerned. And we really need to structure the systems for these 2 streams to come together. Those of us who've worked in the health sector in countries and in global health, and I would challenge all of us, have arguably never spoken to our counterparts on the animal health side. And I think now that we are talking about global health architecture reform, we must make a proactive effort to institutionalize One Health arrangements. Unless this is done, we will never have visibility on what's happening on the other side.
Great, thank you so much. That's a very strong wake-up call, a very encouraging one, especially also for the young generation following us in the next session. Thank you so much again to all the panelists, and congratulations to all the amazing work that you're doing for global health. Thank you. Thank you very much. Thank you.